Today I'm going to briefly talk about infections related to tattoos. And this is prompted by a patient I recently saw. So, when you think about the immune system, one of the major barriers that a pathogen has to traverse in order to infect a person is your skin. So, the skin is a major component, a major constituent of the immune system. So when you think about a tattoo, what you're doing is you are injecting things into the skin, dye. You are breaking that barrier. So it could be a route for things to infect you. So we know about tattoos being obviously the equipment that you get a tattoo with is sometimes it's steel, sometimes it's not quite clean, could lead to bacteria that are on your skin finding their way in, bacteria that might be on the needles and the equipment, viruses, particularly hepatitis C and HIV are two that we worry about when people have unsterile tattoos. And obviously most tattoo parlors are trained. They go through a sterilization process, so that risk is very low, but it's still a risk, especially if you're getting these done not at a traditional tattoo parlor. Well, one of the other more interesting things is that the dye itself that's used to make the tattoo, that can be contaminated. And sometimes it's not the usual characteristic bacteria. It's not staph or strep, but others like mycobacteria. So mycobacteria are a class of bacteria. Tuberculosis is the most famous mycobacteria and also the bacteria that causes Hansen's disease, or what was once known as leprosy. Those are mycobacteria. But there are a lot of other mycobacteria that are found in the environment, in the ground, in the water, that can contaminate tattoo ink, and then people get a skin infection around that tattoo. And these can be indolent, meaning they take a while to diagnose and take a while to grow and take a while to diagnose. They may get misdiagnosed, and eventually somebody does a specific culture looking for mycobacteria and they find it, and then they get placed on antibiotic treatment, which isn't always a simple course of antibiotics. It might be a prolonged course of antibiotics. So the important point to know is, number one, skin, major component of your immune system. Tattooing, make sure that the equipment is sterile, and also think about the tattoo dye being contaminated, and really be careful about where you get tattoos in terms of the sterility, the sanitation at the place that you're doing it at. And if you get infections, make sure you tell your provider that you just recently had a tattoo.